you're going to be filing, there's some new forms, exciting IRS forms that are coming out that you're going to report. Not really, yay! There's 2 new ones. I don't remember the numbers anymore, but you're going to be reporting information on the cost of your single-only premium for your lowest plan, who you offered coverage to, who took the coverage, what you know, and then the IRS is going to go, okay, I offered coverage to Andrea Balogh. I know last year she reported, you know, income well over $88,000. Even if, you know, I could try and say, well, okay, the government won't know. They don't know how much I'm going to get. So they're going to look, and I'm going to push the button that says, give me my subsidy, and I'm going to get a nice note back that says, you know, no way, little girl, go somewhere else. Then you don't pay. Do you have questions, sir?
When you talk about employee limits, numbers, triggers, are you talking full-time employees or total?
In order to, if there's 2 calculations, right? To figure out whether or not you're an applicable large employer, you're going to have to do an equivalency test. You're going to have to take all your full-time employees that work on average 30 or more hours a week or 130 hours a month, and then you're going to have to add in a full-time equivalency. You're going to have to take the hours that the part-time people work and turn them into a person and add that to your total. Once you have figured out whether or not you're an applicable large employer, let's say you are, you don't deal with the part-time employees anymore. If you're an applicable large employer, you're gonna, if you want to avoid the sledgehammer penalty, you're going to offer coverage to all persons that work on average 30 or more hours a week or 130 hours a month and their dependent children. So you don't have to, once you've figured out that you're an ALE, your part-time people are out of the equation. You do not have to offer them coverage. And they were the most generic of generic: hospital coverage, ambulance coverage, pharmaceutical coverage, pediatric coverage. These giant categories that the government said, that's an essential health benefit. With respect to anything that fit into those broad categories, and let me tell you that anything other than, you know, non-invasive toenail fungus basically falls into the category of essential health benefits. With respect to those categories, if you offer it on your plan, if you cannot have a lifetime dollar limit and you cannot have an annual dollar limit. There were some graduated annual dollar limits you can have until 2014, but the amounts are huge. You can't have, basically you can't have dollar limits on those. There is nothing in that law that says you have to offer all of the categories of essential health benefits. With respect to employer-sponsored coverage, it is only if you offer one of those categories. That's very different than the policies on the exchanges. The policies that you will see on the exchanges have to offer everything that's considered an essential health benefit. So you've still got that flexibility available to you as a self-funded plan. I can tell you that most of the fully insured plans are offering all of them, and it's reflected somehow, some way in your premium. Self-funded plans are not subject to the MLR that is imposed on fully insured plans. There's all sorts of people huddled in a corner and trying to figure out how those regs work. But that is something new you have to think about, because that is a new responsibility. But most TPAs will work with you to help you figure out what that is. So, that's what I got for you. I hope it was helpful. I'll take any questions you guys have at this point. I rivet everyone into silence. Yes?
In New York, everything, of course, exists in New York City and Long Island, and they forget that there's a lot of an area called upstate, and it's a lot rural. With some of the exchanges and stuff, are they going to, do you anticipate that they're going to pigeonhole providers and stuff territorially?
You know, I really don't know what they're going to do about that. You are right, it's a very different demographic right where we live.
And where I'm at, you know, it's unfortunately, it's a very low income area.
Yeah. And I think those are some of the problems. And, you know, how do you get the right mix of carriers with the right mix of native coverage that there'll be a product that, you know, people want to buy on the exchanges? I think those are a lot of the questions that they're grappling with is, you know, is there an upstate, you know, Western New York section of the New York site versus downstate? You know, Florida's a gigantic state. You know, I mean, Buffalo's different from Jamestown, right?
Very much so. I mean, Buffalo has a lot of insurance plans available.
Yeah.
I have two. until this,
Yeah.
that I could have chosen from.
So I don't know what they're going to do, and I think every state's answer to that is going to be different, and that's where, and that's why, the idea was for the states to run these things, because, right, they understand the unique population of their state better than the federal government does.
And then from like our side point of view, are we going to have to potentially go out and contract with each of these exchanges and argue with them for reimbursements, or are they going to dictate what they're going to pay?
If your employees go to the exchange.
No. If I transported you and you were on an exchange, am I going to have to negotiate fee schedules?
Andrew, let me pick this up.
I don't know.
I think that there's certain merit and exercise to be had here, because if you're in a state where the state is running the exchange, or the Fed is running the exchange, is there going to be an overriding Medicare reimbursement schedule with new covered policies? So then there you go. You have the individual who couldn't get coverage yesterday can now get coverage today at the same cost as a general population. And an analogy that I use is, when you buy a Corvette, what do you do with it? You drive it fast. When you buy an insurance policy, what do you do with it? You use it. So if you're in a state with a federal-based exchange, and you've got a new onset of new policy holders, it doesn't take rocket scientists to see where it's going to go. You're going to have residents who have new insurance policies that are going to want to use it. If that means going to the hospital via ambulance, what are you going to get reimbursed for? There's going to be a capacity issue, I think, for the first quarter of 2014. So it'll be interesting.
Now, they haven't mandated what the plans need to look like, or what the minimum plan is.
No, we haven't seen the regulations on minimum value. Likely it's going to be, the law actually says that you have to pay for 60% of the coverage in order to meet the minimum value test, but there's no regulations out yet to tell you how to figure out what would constitute that 60%. Whether it's just 60% of the premium, is it, how out-of-pocket maxes and deductibles, co-pays figure into that, not really sure yet, but that's sort of the basic rule of thumb. If you're paying 60% of the cost of coverage, you're going to meet the minimum value test.
But it depends on what that coverage is. You could have a lower plan that has a higher deductible, or HSA plan, and then
That's where you're going to have to,
Cadillac plan. Is it? What are they basing it on?
We don't know yet is the answer.
Right. What we're saying to members is, you build the least benefit, the very lowest benefit that we can structure, and you price it right at that 9.5% like they can. So that's what we're suggesting.
Leading with that, you could have multiple plans within that structure.
Does the employer have to offer family coverage? Like, say Mary is married and she has a husband and a child.
Interestingly, what the regs say is full-time, to beat the sledgehammer penalty, you have to offer coverage to all of your full-time employees and their dependent children. The word spouse is specifically excluded. I'm not really sure why.
So then, I choose not to offer that coverage?
You can choose not to offer the coverage to the spouse, as long as you offer it to the employee and their children to age 26.
But you only,
And you
but
do
they're
not fall
only
into
counting.
sledgehammer. You can't make this stuff up, right?
But they're only counting the 9.5% going towards the individual. So if you say, well, the individual fee would be 9% of your wage, but if you want spouse, family coverage, it is, the employee pays 100% of it. So you
as long as we
say,
have a minimum, then
as long as you have a
anything above
minimum,
that
it's
is
only based on the employee. And everything above that, you can say, well, you can have it, we're offering it, but the employee has to pay for it. Or we pay 50, or you pay.
And that's why, honestly, that's why I was anxious to come and explain this stuff now in January. Because you got plenty of time, right, before 1/1/14, or whenever your plan year starts in 2014, you got plenty of time to sit with your consultant and figure out what your plans should look like for next year. Start now.
Now remember, income is box 1 income. Okay? So if someone's in your qualified retirement plan, their box one income is going to be further compressed because it's,
Yeah, and you can't add it back.
can't add that.
Oh, it's after, what, 401k and all?
Yeah.
So it's after the other things are 425.
So your box one revenue is the benchmark for 9.5%. So thanks for coming, guys. The intention of this was the high level. I wanted to get Andrea in front of you guys.